beautiful story. And it is indeed why we're here. I know I want that, and I'm sure everybody sitting in this room who's coming as an attendee wants that too. You might be ready to start the journey, you might be ready to think about it, you might just be wanting to know how to talk about it. We're going to cover all those questions today. There are resources in the room that are going to be sitting up kind of towards the front that will invite to answer a question or two towards the end as well. So we have 3 medical experts I'm going to introduce. We have 3 survivor stories, 1 married couple, and 2 women who are here. And then afterwards, we're going to try to leave enough time, since we started so late. We'd like you to have mini consults with some of the resources in the room so that you know exactly who to go to for what, okay? So without further ado, I'd like to introduce Dr. Karine Chung. Now, Dr. Karine Chung, you must know she is an overachiever, as probably all the panelists are. She was an All-American collegiate athlete, and she's kind of been an All-American physician as well. She's an absolute champion for fertility preservation in women and an expert on many topics that are relevant to the conversation today. So she is first going to discuss kind of female fertility 101, because even if you're a man sitting in the room who either banked sperm or didn't bank sperm, it's probably kind of important for you to know what it's going to take for your female partner, should you have a female partner, to know how you guys could produce a child. So, Dr. Chung.
Thank you so much for that lovely introduction, Alice, and thank you, Michelle and Alice, for inviting me to be a part of today's events. This is really amazing to be here. It's such a pleasure. And I'm going to try to cover the basics of female fertility in 5 minutes or less. It's really easy. So. Most importantly, the take-home message for female fertility is that the most important factor that determines whether a woman will get pregnant or not is her age. And so that's in all caps with lots of exclamation points, because it's that important. We are all here today because, as we know, cancer treatment, including chemotherapy and radiation, and possibly tamoxifen because of the delay that's necessary before achieving pregnancy, can affect a woman's fertility. And then there's some question that perhaps the breast cancer diagnosis itself also is related to some elements of subfertility, but that still remains unproven. We're going to focus mostly on age first. This was a study that was done back in the 1980s, so we didn't realize at first that age was so important in terms of determining female fertility, but this study was published, and it was actually fascinating. What you're seeing here, all these lines that depict this same kind of gradual downward slope, is measuring pregnancy rates across multiple different populations across the entire world. And this was back in the old days where there wasn't really much contraception around. People weren't using contraception, so these studies were measuring basically the natural fertility rates in populations. And you can see that based on the age of the woman, which is on the x-axis on the bottom, there was a gradual decline in pregnancy rates, and pretty much no matter where you lived in the world, by somewhere around age 45, 46, or 47, people weren't having babies anymore. So we now know that's kind of the natural point at which most women no longer are able to get pregnant naturally. And why is this? Well, it's unfair, but the biological clock starts ticking before you're even born. And so that's because of 2 main issues. One is egg quantity, and the other is egg quality. So this little cartoon is basically my attempt to try to capture what an ovary looks like. So this big blue oval represents an ovary. And as you guys may know, the ovaries are the storage place for the eggs. So all of your eggs are stored in the ovaries. And the little blue circles within the big blue circle are meant to represent eggs. So eggs are stored in structures called follicles. And when you're born with about 2 million follicles, and there's an immature egg stored in each follicle. Before you even have the opportunity to go through puberty, you can see those little blue eggs going away. That's how it happens. They just disappear. And that happens constantly in a woman. So throughout a woman's life, she will constantly undergo egg loss. After puberty, on the bottom ovary there, you can see some of the follicles start to grow. And this is what occurs when someone starts menstruating, is some of the follicles will start to mature, and that's how we know the eggs inside are starting to grow. But in the middle of the natural menstrual cycle, the body will select one dominant egg, and that becomes the egg of the month, which is released during ovulation. And the rest of them go away. So you can see that this is sort of a wasteful process which contributes to the loss of eggs that a woman will experience. So this is kind of a sciencey slide, but basically what it represents is cross-sections of the ovaries, and you can see that as a woman gets older, the number of follicles she has left gets lower and lower, and that's basically consistent with the fact that women lose eggs over time. Egg quality is another very important issue, and basically what we mean by egg quality is the ability of the egg to do everything it needs to do to produce a normal baby. So all these things, cell division, DNA replication, all of that is actually a function of the egg. So you need good quality eggs to do everything that's necessary to produce a healthy baby. So we know that egg quantity and egg quality, oh, thanks. That helps. Egg quantity and egg quality go down as women get older, and that is what we mean by the biological clock. So Dr. Weissman is going to cover how cancer treatment affects female fertility, but one of the things that we know is that it certainly can and often does affect egg quantity, and at the current time we don't think that it has any true effect on egg quality, but often there's an age-related decline in egg quality if you need to delay getting pregnant because of the cancer diagnosis. So options before cancer treatment, fertility preservation. Alice mentioned her journey through fertility preservation, but basically, because it's so difficult to predict whether a woman's going to be fertile or not after her cancer treatment, and because many women are required to delay childbearing after they finish their cancer treatment before getting pregnant, it's important to consider fertility preservation. Who should consider it? Well, of the females, women in the reproductive age range, which we consider 18 to 42, who would like to have children after cancer therapy should consider some fertility preservation options. Embryo freezing is a standard treatment for fertility preservation, and basically it involves a process where mature eggs are removed, they're fertilized with sperm, and frozen and stored. This is a good option for females after puberty. Unfortunately, it's not an option currently for women who are prepubertal. And it takes about 2 to 6 weeks depending on a woman's menstrual cycle. There are hundreds and thousands of babies born from frozen embryos. The last estimate was somewhere around 300,000 babies born from frozen embryos. So we know it's safe and we know it's effective. Now, egg freezing is a little bit different. Egg freezing is still considered experimental because for many, many years it didn't work very well. This is not really the case anymore. Since about 2005, we've changed the way we freeze eggs, and really it appears to be working as well as freezing embryos, but it still has this experimental label because there are not enough babies born from this type of technology yet. We think that in the next couple of years that experimental label will probably be removed, but we're not quite there yet. This process involves removing mature eggs, freezing them, and storing them without fertilizing. An ultrasound of the ovaries, and we can look at the volume of the ovary and a resting follicle count, which we know decline with age and also are good indicators of reproductive potential. So this is what an ovary looks like on ultrasound at the beginning of a menstrual cycle, and these little black circles are the immature follicles which contain eggs. So women with, quote, normal fertility at age less than 40 should have about 12 of these at the beginning of a menstrual cycle. Older women are expected to have fewer, but as long as you have 6 or so, if you're over 40, you're in good shape. When the numbers are much lower, that's an indicator of diminished egg supply again and low reproductive potential. So any of these tests really are most useful when they're abnormal. When they're abnormal, they really help us understand that the chance of getting pregnant naturally is probably very low. When the tests are normal, age is the best predictor. So are there ways for me to become a parent if I'm menopausal? I'm going to talk about each of these options, but donor eggs and donor embryos are certainly options for patients who are menopausal. People who are menopausal can carry a pregnancy, no problem. The limiting factor with getting pregnant after cancer treatment is due to the number of eggs and not due to the uterine aging or anything like that. So basically, donors can be anonymous or known donors. The donor eggs would then be fertilized with the survivor's partner, and then the women who are infertile or in menopause can...
Good afternoon. You still have a few minutes to join us in the auditorium, the computer auditorium, for a free LA Opera concert. This concert will be very special today as there are going to be 7 LA opera artists performing. It's a wonderful treat, and it's in the auditorium. Don't miss it.
Wow. All right. So treatment with donor eggs and embryos is a very successful type of treatment, and many women have successful pregnancies that way. Adoption is definitely also an excellent family building option, and I think there are resources to talk further about that today. Just want to talk briefly about gestational surrogacy. This is a situation where a gestational surrogate carries a pregnancy for someone who cannot. One or more embryos are transferred into the uterus of the gestational surrogate, and donor eggs or donor embryos can also be used and replaced into a gestational surrogate. Pregnancy rates are very good. They depend on the age of the woman at the time that she produced the eggs. And surrogacy laws vary from state to state, but probably the best place in the country to have a pregnancy by gestational surrogacy is in California, so that's good. So thank you. I know that was fast, but I'm available for questions later.